decide?
We're live.
Okay. Larry's gonna start.
Okay.
Larry, you ready, Nick?
Yep.
Good afternoon. The goal today is an attempt to show you where we are with COVID cases and hospitalizations, how we got here, where we are going, and what we can do to change the course of our destiny. Our concerns are based on data driven by past practices during events such as a church service, Halloween, Thanksgiving, and where we may end up if we do not change our behavior going forward into Christmas and the New Year's holidays. We not only believe but are convinced that we can dramatically change these projections of COVID cases and hospitalizations by simply limiting gatherings, social distancing, and wearing masks. It is your personal responsibility to protect your family and neighbors by following these basic rules. It is that simple. And with that, I'll turn it over to Ryan for some of the data that he's come up with.
Thank you, Larry. As you can see from the chart, our linear progress here continues to be about straight up. So when we talk about flattening the curve, Lewis County's curve is not flat. It is almost completely straight up once again. Active cases right now sit at 122. To put that in perspective, back on about mid-October, October 15th or 16th, we were sitting around 3 or 4 active cases. Now, just 2 months later, we're up to 122 active cases. Currently, there's 11 folks in our community that are hospitalized, and we have 107 people who are quarantined in addition to the 122 who are isolated. Unfortunately, to date, we have also had 4 deaths related to COVID-19. What we want to show in the chart here is 3 very distinct spikes. So if there's one thing we know, if there's folks out there that still aren't certain about the science or the math or the data behind this, let's look exactly how behavior affects our numbers. Behavior directly influences the spikes that you see on the chart. We had a baptism, which was a super spreader event. That kicked us off, and you can see the spike very clearly. Then, what's next? Halloween. And everybody sat here and said, please don't gather on Halloween. If you do have Halloween parties, if you don't change your behavior, we will have another spike. What has happened again? Another spike at Halloween. Thanksgiving. Our same crew, we sat here and we tried to remind folks, let them know that if your behavior does not change, if you treat Thanksgiving like a normal year, like an average year, nothing is different, no pandemic, then we will see another spike. And that is exactly what has happened. We're sitting here today to tell you that if you do the same thing for Christmas, if you continue to treat this as business as usual, then we are really, really going to start pushing the capacity of our healthcare in Lewis County. But first, I want to have Ashley expound upon what is so dangerous? Why are these small gatherings generating the caseload? So Ashley, can you speak on that, please?
Yep. So the majority of our cases are associated with being a household contact to a positive case, small family gatherings or other social gatherings. And what's happening in these areas is people are within 6 feet, or they're within, the same room for an extended period of time. They're sharing things. If somebody is infectious, it is spreading throughout everybody that's at that gathering. What I did want to know is we are not necessarily seeing a lot of spread in areas that are currently following the guidelines. Institutions that are masking, social distancing, following all of the guidelines that we have laid out, we are not seeing spread there. Schools have been very successful with their reopening. We have not seen any spread in the cases that we have had at school, which is outstanding. And even other businesses that have done a good job with following the guidelines, we are not seeing the spread there. So the majority of our cases are the social gatherings and household contacts at this point.
Very good. I think what's important to reiterate here is that especially our students and our school communities have been doing a wonderful job, and it really goes to show you that these basic principles work. Our schools are putting hundreds of kids in the same building every day without transmission. Why? Because they're wearing a mask, they're separating them out, and they're keeping folks in cohorts or bubbles. So you have to think about your family and your household as a bubble, as a cohort. When you start mixing with other bubbles, you know, it may seem like a safe party to go over to your in-laws, but if your in-laws invite one of their in-laws, now you're 3 degrees of separation with people you don't know where they've been. And it seems safe and it seems like it's not a big deal, but that's where the transmission is coming from. The next thing we want to talk about is healthcare capacity. You can see from the chart here that if you go back to October, we had really, no hospitalizations. Then quickly it jumped up and we hovered around 5 for a while. Then, we had the, you could associate it with Halloween. We jumped up to around 7 and hovered there. And now after Thanksgiving, we are hovering around 11 hospitalizations. There's a gray line across the top, which represents the maximum capacity of beds we have at Lewis County, beds that we can staff. And that's 32 beds. And what we're trying to say today is that if this orange graph continues to rise, there's only so much available healthcare in Lewis County to cover that. And Jerry Cayer will cover that in more detail.
All right, thank you, Ryan. Good afternoon, everyone. So let's talk about the beds, and I'll add a little more detail. As you know, as a critical access hospital, we have 25 hospital beds, and they are in 3 distinct areas: medical surgical, ICU, and OB. So it reflects total beds. We received an order from the governor 2 weeks or so ago asking that we increase our capacity by 50%. And that means we would add 13 beds, which then brings us up to 38 beds. Earlier this week, we received an update on that, and we're told, don't need to do 50%, do 25%. That's the 32 that Ryan is referring to. However, we, within a few days of that initial order, had added 13 beds to our complement. So we have not taken out the 6 beds, and we have all beds set up. The difficulty is, in setting up these beds, we currently have 1 4-bed ward and 1 8-bed ward. And I was commenting to my team recently, my goodness, this is what they did in the 1930s. LCGH was operational in 1931. This notion of wards was how you practice medicine. It is unbelievable that in 2020 we are creating an 8-bed ward, but that is our situation. Right now we can reasonably staff the 25 beds that we are licensed for, and if push came to shove through some reallocation of staff from clinics and other parts of our operation, we could staff 32 beds, which is why we've used the 32 in Ryan's graphic. My goal is to figure out how to staff 38. Earlier this week, we had a situation where there was a 24-hour period. We only had 1 available bed in the house. There was a situation over this past weekend, 50% of our occupancy were COVID positive patients. So this is really changing the landscape of individuals admitted into the hospital. We still do other things, right? We have the ICU and we have OB. And today, right now, we have 2 individuals in our maternity unit. If we use all the beds, there are going to be some services we will be unable to deliver. So the team is really working on contingency plans so that we can still continue to provide services. But the growth of COVID positive cases in Lewis County are very troubling, and every single day we are meeting, making sure we've allocated the right staff to the right beds and that we're able to meet the needs. As we sit here today, we have 22 individuals occupying our beds, which means we only have 3 available beds. Thank you.
Thanks, Jerry. So I think an important thing to note here is that maybe 11 of the beds are taken up for COVID, but that's not the only thing our hospital does. So folks that want to have their next child at Lewis County General, well, if we don't have beds available, they're going to have to go someplace else. Folks who have some type of trauma, if beds aren't available, they'll have to go someplace else. We are a community that takes pride in being able to take care of ourselves. We invested and own our own healthcare system because we believe we can take care of ourselves. Well, right now our actions are heading us towards a direction where we will not be able to take care of ourselves, and that's very unfortunate. Other consequences, I hate to say it, but if our numbers continue to trend upward like they are here, then you can look forward, unfortunately we might have restaurants may have to close, as the governor indicated earlier this week. Schools being closed would obviously be devastating for our families, but those are the types of things that may have to happen if behavior doesn't change. Luckily, we do have some hope, some good news. Vaccines are progressing very quickly, and Jerry and Ashley are going to expand upon some of the plans that we have and some of the things we've heard for vaccines in Lewis County.
So, from a public health perspective, vaccine distribution is something that we do on an annual basis. We do flu vaccines. We actually drill for large vaccination clinics on an annual basis as well. So this is something we are prepared as a local health department to do. We are approved to be a COVID vaccine provider. We're currently working with the state to identify our timeline, how many doses we would receive, and how we will distribute that. So when I have more information on that, I will share that with the community.
Okay. All right. So the way the vaccination programs will be working are there will be different pathways for different populations. So Ashley described the pathway for the general public. For the health system, there were 3 other pathways. Related to long-term care specifically, there were 2 distinct applications we had to complete, and they have been completed and acknowledged. The federal government is contracting with the private sector to vaccinate the residents of long-term care facilities and employees. So that is sort of moving along. Then the final pathway is on the hospital end. And in an earlier briefing, I had reported that we had completed the application. It was accepted, and 2 hours ago we did our first pre-book of 200 vaccines, and these vaccines are earmarked for healthcare workers. So the next step in our process is risk stratification to identify those employees who should be eligible, first in line, if you will, for the vaccine. So individuals who work the ICU, medical surgical, DED, respiratory, those folks who are at higher risk because of the patients that they care for. The particular vaccine we will be receiving is the Moderna vaccine. And in the application process, I was able to identify what our freezer storage capacity is, and we do not have the appropriate freezers for the Pfizer product. How the product will make its way to us, based on a conference call with DOH earlier this week, is through regional hubs. And as of this morning, it has not yet been confirmed who the regional hub for the North Country region will be. And then through that hub, all of the hospitals within that region will come together and work the distribution of the vaccine to the various sites so that they can be administered. This particular shipment is for the first dose of the vaccine, and as we've all read, it requires 2 doses. And there are some specific requirements with regards to when the second dose has to be administered. So it is the second step of many more steps that will have to be implemented before the first vaccine is administered.
Very good, thanks Jerry. We're going to wrap up and take some questions, but the last thing we wanted to say is, look at the chart, follow the numbers, follow the data. This is not political. This is not, a social debate issue. COVID-19 has no political position. It has no beliefs on Democrat, Republican. It is simply science, and it is simply numbers. And the science and the numbers tell us that if things do not change, if people do not adjust their plans for Christmas, we are going to be in a serious situation in Lewis County. We are lucky. We've got a great buffer. We've got a great health system, but that buffer will only get us so far. So the message, really the main message, the takeaway from today is, as you're talking with your families, as you're preparing for Christmas, you're having those conversations, who's going to bring what hors d'oeuvre, who's going to wrap the presents, where are we going to put them? You really need to think differently this year about what your plans look like. That's what we're asking you. Please look at your plans. Think about how you can adjust. This is not a normal year. The vaccine is on the way, but between now and the time the vaccine is available to the public, we could have some serious issues in Lewis County. So please look at your Christmas plans, your holiday plans, your New Year's Eve plans, and be smart and think about your neighbors and your friends that are maybe not as lucky as we are. Think about your neighbors and your friends who are recovering from cancer or currently under chemo treatments. Think about your neighbors and friends who are elderly or have diabetes or other health care issues. Those are the folks. Your actions, your family might be okay. Maybe you'll make it through, but you're limiting the freedom of other people, especially people right now who are very susceptible to this virus. So that's our message. Please, as you're making your Christmas plans, recognize that this year is different, and recognize that the path that we're headed on in Lewis County is not a good one right now. So with that, we'll take a few minutes of questions and we'll wrap it up.
When you said you had it earmarked for 200, do you know when that's going to be coming in?
No, not at this point. I suspect it would be sometime within the next 2 weeks, but the regional hubs have to be operationalized, and then it has to get from there to where we are. And we've already done an analysis of our capacity to store these vaccines, and we could store up to 2,000 doses within the health system.
Will it be mandatory for the employees of the health system and or the nursing home to be vaccinated?
Yeah, that's an interesting question, and as you can imagine, there's been a fair amount of conversation within the health system regarding mandatory. That's one we're going to take guidance from the Department of Health, and locally, I certainly would not push that as a policy position. I think it's one thing to have an expectation about wearing the mask. It's a vastly different discussion when we would say we will inject something into your body. So I don't think that will be the larger policy position. I will do all I can to educate the staff through Q&A. I will encourage everyone to consider it. And it would be the same with the residents. At the end of the day, they will determine, or their guardians, or in concert with their family members, if they will be vaccinated. And when the time is appropriate and they get to the bottom of the risk stratification list, I will be in line. I will get the vaccine. I've seen enough of the science, and I have great confidence that it will be effective.
A couple of questions for Ashley, just kind of on like reporting topics. So if I could just ask a couple of things and maybe you could address them. People are still asking about the discrepancy between the state reporting data and what public health reports. We kind of try to steer them to the public health data as the most up-to-date or official data for Lewis County. Some people have been asking the question as far as when penalties go into place or if the state's using yellow zones, orange zones, are they using their data or your data? Because they are actually showing quite a few more cases in Lewis County than what Lewis County Public Health is actually reporting.
Yep. So there's been discrepancies in the data right from the start. And the reason for the discrepancy is they pull their data from the statewide laboratory reporting system. And they tell me that they deduplicate when there's a positive case that's tested multiple times, so that's positive coming in multiple times. And they also account for individuals that are not necessarily our county. So when we go in and we receive the reports for the day, we go in and we check 911 addresses. If they are not our county, then we transfer them out. Vice versa, other counties transfer cases to us. The state's system is not perfect. Ours is our actual cases for the addresses that we have here in Lewis County. And as far as the death data reporting, that's not something that's going to be cleaned up. I've requested that multiple times, as other counties have, but our data is the most accurate data.
But when the state, so when people are looking at, positivity rates and things like that, the state is actually basing that on that data that's not actually as valid for our area. Is that accurate? Okay.
Correct, but they also speak with us on a daily basis in regard to what's actually going on here. What's happening with our contact tracing, where are we seeing our cases come from, where are your issues? So they are taking that into account when they're making those decisions, and we have not been designated as a zone yet.
Okay, and we see the regional positivity rate posted through the state website and things like that. With so much emphasis being put on the positivity rate by the governor and how it triggers certain things, is there a place like where we can see Lewis County's actual positivity rate every day?
Yep, so if you go to the New York Forward website, you can drill down by county. So they do have it by region. If you click up top and click by county, you'll see that it has it there.
Okay.
It is with their numbers, though.
Is that something that you could include a Lewis County positivity rate in the daily public health update, or is that not something you? People have been just asking about a lot.
Take the test that day divided by the positives.
Right.
Right. The positivity rate.
Right.
Kind of.
Yeah, I can look into that.
Okay.
And I have one for Jerry.
Yes.
In your time with Lewis County Health System, do you ever recall having this many beds filled for any reason?
There are certain weekends. Short answer would be yes, but it was usually associated with a significant activity that was occurring in the county. So there's this concert that occurs down in the Turin area. There's certain snowmobiling events and four-wheeler events. And those weekends tend to generate a lot of ED throughput as well as some admissions. So they're, I would say, episodic and basically an acute event rather than a pandemic, which is a sort of long, rolling wave that keeps growing. That's how it's different.
And can you talk a little bit about, just so people understand what the worry is about the stress on the healthcare system, and some of the things that are going on regionally. So can you talk a little bit about like surge and flex, and are all the hospitals in the region kind of working together? Say you were filled up and reached capacity, would there be diversion plans with other hospitals? And could all 25 beds in your hospital theoretically be used for COVID patients, or are there only specific beds assigned for COVID patients?
So
There was a lot there,
Go
sorry.
backwards. You had a few questions there. Generally speaking, we don't save beds. Okay. I do think there has to be an internal conversation when it comes to maternity. We have a sense of forthcoming deliveries, obviously, and if we save beds or hold beds, then that means there's someone who we would have to look to transfer if all of the other available beds were filled. So I know that's not a black and white answer, but in real life, that's how we would work through it. With regards to the relationships with the other hospitals, we all work together. And in fact, we are on a weekly basis participating in a Zoom call, and we all share what's happening in our systems. What's unique about this call, it also involves public health of the Tri-County region and the county leadership. So Ryan participates, for example, from Lewis County. And it's an opportunity for everyone to have awareness what's happening within the region. I think that's helpful. I think we have transferred to Samaritan in the past. We've transferred to St. Joe's, the Mohawk Valley, Syracuse, or upstate. I would anticipate we would still do some of that, but it will become harder. Beds are becoming harder to find. In the North Country, we're still somewhat fortunate because, as Ryan presented, we still have available beds today. Right now, we have 3 available beds, okay? And I know there will be some people discharged today, but that's how it works. We're usually not this close, right? But we're managing it. Samaritan is doing a great job managing their situation. But we were on a call, and the beds in Syracuse are very tight. So there's that aspect. But the local hospitals, I think, do a very nice job of reaching out, supporting each other, that sort of thing. I think the bigger challenge for us, or the additional challenge for us, is how to staff 32 beds if we ever got to that point. Like all sectors of the economy, we have had staff that are positive. And we report that daily, how many individuals, both on the acute side and at the nursing home side, are positive, which means that they are isolated, right? In healthcare, if we're under quarantine, we can work. So there have been days we have been very stressed on that front. And even before the pandemic hit, there was a nursing shortage in upstate New York. And we're not talking just a few hundred, we're talking thousands. And we were not immune from that. And prior to the pandemic, we had a number of positions that were open. So that one we deal and manage on a day-to-day basis.
And there's been a lot of progress since the outbreak at the nursing home. Did you just want to update a little bit on that? It seems like many of the residents have recovered at this point, and it pretty much was contained to the second floor for the most part. And did you just want to update how things are going there?
Yeah, thanks. The team there has done an incredible job. And when I say the team, the nurses, the CNAs, environmental services, facilities, dietary, respiratory, pharmacy, everyone has worked really hard. I think from start to finish, we've seen improvements, and we are almost to the point where over the next week, there's a good possibility we will hit everyone being recovered. We only had one resident, and it was reported in one of our daily briefs from another floor who tested positive, and then we worked with the appropriate people, and they were transferred to our designated COVID unit. We were also able to use some experimental treatments, and we had administered 3 for individuals who met the criteria. We've also had individuals who were administered remdesivir. So we've been very creative, and I'd be remiss in not acknowledging our medical director, Dr. Shirley Tuttle-Malone, working with our director of nurses, Mackenzie Belanger, and working also with our administrator, Deb Wertz. I mean, this team has done a great job, plus the supervisors and the leadership, nursing leadership on the second floor. So it's going in the right direction. We're very happy about that. The challenge right now, and this is a statewide challenge, if a nursing home resident was admitted into the hospital, they have to present with, in order to return, they must have a negative COVID test. You can test positive for COVID weeks and months after the event. So a lot of beds throughout the state of New York are being used for nursing home patients who have gone beyond the 14 days, they're symptom-free, and they've not needed medication to manage symptoms. And so that's an active conversation. In fact, we've had 2 conversations this week with Haney's and the Department of Health, just talking through that. Hopefully we can move that issue. So how does that affect Lewis County? We have 2 individuals right now who would be appropriate for the nursing home if they didn't have to have a negative COVID test. And we think truly it will be weeks and months before that could happen. Just, the antibodies and that whole sort of thing. So, yeah, good progress there. The team has done a great job, and everyone has pulled together. The other thing we've been able to be more attentive to, and I appreciate the families who reached out to us, we've changed how we're communicating to the families. When you're in the middle of it, living it, there's always something you can do better, and we received some very helpful, constructive feedback and have changed our communication approaches with the families, and since then I've gotten some very positive feedback from the families.
Okay.
Last question, guys. We all got 2 o'clock commitments. I'm sorry.
Okay, I'll just ask one quickly. Is you've been repeating yourself a lot over the last several weeks, months, everything, just telling people, please just listen to us. This is what science says. How frustrating is it that they're still not listening, and are you going to start imposing fines or otherwise punishments?
It's an interesting question about the enforcement because the cases scientifically, the data doesn't tell us that the cases are coming from businesses or churches or schools. Right now the data tells us that it's coming from individuals who are choosing to get together in social settings outside their household units. So the county's not interested in fining its citizens. That's not something that we're interested in. But we are interested in everybody understanding the consequences of their actions. I think there's a disconnect that people that are young and healthy and you feel that you're immune to this, and you know what? There are some folks that might get this virus and recover in a week and they'll be fine. But you know what? Your actions still have consequences, not only for other people, but for you. Because if you don't take it seriously and our hospital gets filled up, you may be young and healthy and invincible, but you still have accidents. You still could get in a snowmobile accident, you still could cut yourself at work, and you might need to walk into the hospital one day, not for COVID, but for something else, and we say, sorry, there's no room. So even young and healthy people need to understand that their actions have consequences. And if you can't understand that your actions have consequences for others, then maybe we can put it in the terms of it will still have consequences for you, because nobody's immune to accidents, and everybody at some point needs access to health care. So with that, we'll wrap things up. Thanks, everybody. Appreciate you guys coming out. Sorry for the late notice, but we appreciate you guys being here. Thanks.